I know Dr. Moongrady had talked to you
Yes,
before,
yes.
and our plan was let's try to get home, right?
Yes.
And then Friday going into the weekend, things didn't
Yep.
go so well, just feeding.
Yeah, yeah.
But I think we're gonna perk back up again, which is
Yeah.
great.
Mm-hmm.
We're gonna get an ultrasound of the heart. Did they get it already?
Not yet, no.
Not yet. Yeah, I didn't
We
see
keep
it on the
hoping.
list. Sorry?
We keep hoping.
I know.
Not like
These
this.
people. So as you know, there's the heart defect inside, which is the canal
Yes.
and the double outlet, right? But then there's
Yeah.
also that PDA that might close on itself.
Yes.
So sometimes we see this that kids, they get better because that PDA closed, which is great.
Yes.
And then they start feeding on their own and doing better. So I'm hopeful that that's the case. We also had gone up on the support, so we gave
Yeah.
positive pressure and some Lasix. So that's
Yeah.
some medication that will dry up the lungs a little bit. We're now back to the plan of trying to get you home, all right? Because she's done so much better.
Yeah.
All right.
Right.
So what plan's gonna be, we'll get the echo, see if that connection has closed. Even if it didn't close, that's fine. But it's good to know
Yeah.
what we're dealing with, and then we're gonna try and go down on the respiratory support. They also went down a little bit on the Lasix because there's sodium was
Yeah.
a little low, and we'll see if we can go to either no oxygen at all, no respiratory support, and we're still growing and feeding.
Yeah.
That'll be great. Then you guys can go home.
Okay, yeah.
And we'll get the surgery
Yeah.
when she needs it. Right?
Yeah.
So, it doesn't mean that we're not gonna ever do that first surgery, but who knows? Maybe if we can go far enough, we can just get a Glen instead of getting the band, then the Glen. Right. So, do you
So
know?
the band is for the PDA. That's okay.
No. So, if you have a piece of paper, we could probably draw that. So normally, right, there are. So the surgery that is needed for sure, obviously, is the Glen and then the Fontan, right? So
Okay.
that's down the line.
Yes.
In the beginning, if there's a lot of blood going to the lungs, we'll try to band the lung artery. It means make it smaller so that not a lot of blood goes there.
Yes.
But there are some patients where they don't need that because just the way the blood flows, it's not a lot of blood going to the lungs. How do we know that? It's exactly breathing fast,
Yeah.
feeding.
Perfect.
So if there's a lot of blood going to the lungs, you'll breathe
Yeah.
faster and you won't be able to feed and grow. So as long as we're able to feed and grow, we can in fact wait until we get to the Glen.
Yes.
The Glen is usually at 4 to 6 months. So we need to wait some time.
Yeah. Yeah.
So that's where we're trying
Okay.
to, but
So the Glen is like an open heart surgery, right?
it can be done without being open heart. In
Okay.
fact. Yeah.
Oh, good.
Yeah.
Okay.
And our surgeon in fact tries a lot of time not to do it open heart. So there's a chance that we won't need to be an open
Oh,
heart.
good.
Yeah.
Okay.
So yeah, Liliana's drawing. She's the artist.
So she doesn't have an AV canal.
She does have an AV.
She does have an AV canal.
But
Okay.
it's what we call an unbalanced AV canal. It
Where
can't be corrected.
They're both on the right side.
Yeah.
Okay. Okay.
Yeah.
Trying
So if half of if half of that valve was on the right and the left,
Mm.
then it's easy. We just split it in half.
Mm.
But if all of it is on the right side, there's no way for us to push it or pull it to the other side.
Got it.
So we
Okay.
can't do a full repair.
Got it.
So what we're deal with then is the heart will pump to the body, and we have to figure another way for the blood to go to the lungs,
Mm.
right? And the way we do that is connecting the vein draining the head and neck and the vein draining the body directly to the lungs.
Mm. Got it. Oh, I see.
And we have to do so. This is the Glen surgery. That's usually around 4 to 6 months. And this is the Fontan. We do about 3 years of age.
Okay.
Unfortunately, we can't do them
Together,
right now because
yeah.
we've done it before and it fails.
Yes.
It's just the vessels are too small.
Yes.
The clot, it doesn't work.
Yes.
So we need to wait 4 to 6 months here
Mm.
and 3 years, around 3 years for here.
Yeah. Okay.
In the meantime, if she can grow on her own with no other surgeries, we're happy.
Yeah.
But sometimes, because there's a lot of blood going to the lungs, kids just breathe too fast, they don't
Yeah.
eat well,
Yeah.
and we need to do something. And that thing
Yeah.
will be to restrict a little of the blood going to the lungs. So we put it's
The
in fact a
band.
small,
Mhm.
in the world of heart surgery, it's
Yeah.
a small surgery. In fact.
Okay.
That's off pump. They just open the chest and put a ribbon around it and just tighten it, and that's it.
Okay. Oh,
Right.
okay.
Coming up. Okay, I think
She does the art, I just check accuracy.
all of the common.
Yeah, but once you just make this valve a little so it's clear. I wouldn't start the valve from here,
Okay.
right? Like that. And that's how it is in fact on the echo. It covers up. Right, it covers up all of the inflow. Right? Alright, so here we are. Perfect. Look at that piece of art. Okay. So this is the canal. So this is one side of the valve. This is the other side. So it's bigger there. And all the blood coming in is supposed to go. Half of it's supposed to go here, and half of it, but it's all going here.
Right.
And we can't. You know, if we close the defect, it'll be like this. There's no inlet. There's nothing. Nothing will go in here.
Yeah.
So we can't unfortunately do that. So the only way we could do is what we'll do is we'll in fact get all the heart to pump into the body and tie off this artery that goes to the lungs and get this vein then to go to the lungs directly. So we'll connect these two together. That's the first surgery. Here we'll connect these two together and disconnect it from here. That's called the glen. And then the second surgery will be to disconnect this from here and put a tube all the way up, also up there.
Wow.
And that's called the fontan.
What's it made out of?
So it's made out of Gore-Tex, which is a it's like the the Teflon.
Yes.
Yeah, so it's the lining that
Oh, I
so
see.
nothing sticks to it, so
Yes.
the blood doesn't clot on it.
Okay.
All right. So then when we do that, then we have blood going to the lungs and the heart pumps to the body. It's not normal
Yeah.
because normally there's still heart should pump to the lungs,
Yeah.
but it's the best thing we can do.
Yeah.
All right.
Okay.
Did somebody talk to you about long term what that means to have a single ventricle?
No, but my question would have been is, does it grow with her?
Yes, it's a
Or-
great question. So this first one is really vein to vein, they both grow. This is all organic
okay.
material. This here is not organic material, but one of the reasons we do it at 3 years is the surgeon will put some lax into it, so we don't need to change it. Even as she gets
Okay.
much taller, it'll still be fine. All right.
Good. Okay.
And that's why if we do it now, we'll have
Yes.
to go back in and change
Yeah,
it. But
yeah.
we do it later so that we don't need to change it.
Oh,
Okay?
very
So
good.
that's a great question. So why do we normally have two pumps, right? One to the body and one to the lungs. Because let's say you want to go exercise,
Yeah.
you need more blood. So
Yeah.
you need more blood to be pumped
Pumped
into the lungs.
body, yeah.
So when you have this, which is no pump,
Yeah.
just blood's gonna fall with the gravity or with breathing it. That means that kids can do everyday life activities, but I would say usually they're not athlete level
Yeah.
exercise.
Yep.
So that's one limitation of having this problem. The other limitation is also when you have a pump, it's much better drainage to the body. So not having the pump over time can lead to what we call stasis or congestion. So the blood isn't being drained as well.
Yeah.
So some backup in the organs.
Yeah.
That can affect all the organs really. So it can affect the liver over time. And time here we're talking about years and years. Right? But it can also affect the intestine, the kidneys, the lungs. So all of this needs to be followed.
Yeah.
How often does it affect it? I would say not every kid is going to have every single organ affected, but by age 20, almost all kids will have an organ affected. Right? So we do expect things to go wrong, but our hope is that there'll be things that can be treated and can be managed.
Yeah.
All right? And again, we are talking about, when we talk about young adults, they had their surgery 20, 30 years ago. So we think we're much better now.
Yes. Yeah.
And in 20, 30 years,
Yeah.
there'd be so many more options.
Yeah.
So it's hard nowadays to
Yeah.
promise anything. Things change so fast.
Yeah, yeah.
Right? And again, because the heart is not normal heart, some of these kids need a heart transplant during their life. Sometimes
Right.
just the heart can't keep up just because it's
Yeah.
not formed normally.
Yeah.
All right.
That was going to be my next question.
Yeah,
Yeah.
but so it depends on. I mean, for canals, in fact, so hypoplastic left hearts, about 50% of them need transplants in young adults, so 20, 30 years. When you have this configuration, is in fact better because you do have a left side and a right side. So usually their heart function is better preserved than hypoplastic left heart. So this is in fact better.
So the part still pumps. It's just that it's these vessels that are.
Exactly. If this
Formed
was
wrong.
just it's this valve. It's just shifted a little bit this way, then we could have closed it off. And then that is so much better. Yeah. But
Okay.
so this is the PDA. We'll just take a look at it. It pushes more blood into the lungs. So we're hopeful that it will close
on its
and then
own.
we don't
Yeah.
we don't need to
Do the
deal with
band.
that.
Okay.
Well, the band is here, right? So this is where we put the band. So if she's breathing too fast, the surgeon will go in and band this so that not a lot of blood goes into the
Okay.
lungs. All right.
So that band still has to be done, whether the PDA closes or not.
Well, the PDA closes or not, but the band. Sometimes we're so lucky that they're growing. We say, well,
Okay, it's not affecting her.
it's not affecting,
Yeah,
right? And
yeah.
so why should we go in and
Yes.
do it?
Okay.
Yeah.
Yeah.
Then we'll go ahead and do this one.
Yeah. Then so this is at 4 to 6 months.
Oh, got it. Okay.
4 to 6 months. So if we can wait that long,
Yes.
that'll be great. But sometimes we can't. This is around 3 years. And this one here, this is the question mark.
Yes.
We don't know if we're going to do it or not.
Yeah, got it.
All right. So if we can go off CPAP and she's breathing and she's feeding and growing, we can then say we probably don't need it. It doesn't mean that in 2-3 weeks on your follow-up that if she starts breathing fast, it means we need to come back and to get it
Or if
done.
she's not eating.
Or she's not eating.
That's like the bigger
The
sign.
biggest thing is she's not eating.
Yeah, that was going to be my question. If we go home, like, what should we look out for? Because she does look normal. Like, this whole routine that we're doing, it looks normal. So I wouldn't know that, okay, she needs to be seen ASAP. So,
Yeah,
what are some...
so your doctor is going to be, there's going to be scheduled follow-up.
Okay.
Right? So, and you can call, like, you can get even earlier follow-up. But I would say for her, I would probably say see her in 2 weeks.
Yes,
Right?
okay.
And maximum every month.
You're
Yes.
going to doctor
But
a lot.
yeah, you'll be
Yeah.
going, in the
Don't
first,
watch it.
yes, exactly.
Okay.
Because you need to keep an eye on
Yeah.
that. And if she's not feeding, that's your first sign. that
Yeah.
she's getting tired.
Yes,
Right? Then that's a sign to
And
come.
even that, like I noticed last night, she was breathing pretty fast. And, that wasn't normal from the week, this
Yeah.
entire week that we've been
I have to say
feeding her.
she's being better. So
Yeah.
I'm curious to see what the PDA's
Yes.
done. Maybe it's closed.
Yeah, praise
Yeah.
God. Okay.
All right.
We're
Okay.
praying on
She
that.
ends up needing this. There's nothing wrong that you did at home. It's not that she's failing.
Yeah.
She just
Yeah.
needs
Needs it.
something. And
Yeah.
then we support her as much as she's doing a great
Yeah.
job right now, like eating and everything.
Mhm.
And if that happens, then she needs it.
Yeah.
And that's it.
Yeah.
Yeah.
Okay?
Yeah. So one thing it's a very good point that you bring up. You might be asking, well, why wouldn't she need it now? And
Yes.
she'd need it again in 2-3 months.
Yeah.
Because all of us normally, when we're born, there's no air inside for kids to breathe.
Yes.
And when kids come out, they take a deep breath, and that opens about half of their lungs.
Got
Doesn't
it.
open up all their lungs.
Oh, I see.
And then over the next 2 months, as they breathe and breathe, then it goes to normal. So it takes from birth to 2 months.
Wow.
All right.
the
And so
full
right now there
functionality.
could be not that much blood going in because the
Yeah.
lungs are not yet
Fully developed.
exactly. And by 2 months that's going to happen. So over the next
Yeah.
few weeks,
Yeah.
she might get more blood into her
Yeah.
lungs because of that, because there's
Right.
more lungs being expanded, or
Got it.
the resistance in the lungs is dropping. Unbalanced, complete. I'm going to write this so in case you need to
Yes,
look
thank
it
you
up.
so much.
Atrio.
So looking at the band, whether it happens now or later, what are we looking at as far as recovery?
Yes, that's a great question. So recovery for a band is pretty short. So we're talking about a week to 10 days.
Okay.
Yeah, it's not
okay.
open heart.
Yeah.
The pulmonary artery is the first thing. So when the surgeon opens the chest, that's the first thing that hits them in. So they just open the chest and then put a band around it and close the chest.
Okay.
They don't need to stop the heart. They don't need to open the heart.
Okay.
So it's really then healing from this incision. So
Okay.
that's in fact the smallest surgery they need to do.
So that doesn't push back the
No,
gland happening.
Not
Okay.
at all. Right, and then the gland that may be open, but the surgeons nowadays can in fact do it, and they have a certain ways of doing it that they can in fact do it with the heart beating.
That's amazing.
So
That's changed.
that has changed for
Yeah.
sure. Yes. So I'm hopeful that hopefully we don't need
Yes.
this just because it's another surgery.
Yeah,
so,
I know. You're right.
yeah. Okay.
All right.
All
Well,
right.
at least you gave us something to pray on. So thank you
Thank
so
you so
much.
much.
Appreciate it.
That's kind of an exercise. How much exercise is she going to be able to do?
Yeah.
Is she going to be like playing baseball where you sit a lot and then you get up and do a little bit?
That so they do PE, right?
Oh.
That is fine as well. In fact, some of them. I mean, there are obviously poster
Yeah.
child kids who
Do
have
it.
gone
Yeah, do
mountain
it.
climbing, and,
Yeah.
but I would say most kids will go to school, they'll do PE, that should be fine. But you'll see that when they go on their mile run, they're probably the
Yeah.
last person coming in.
Yeah.
They
Yeah.
still can do it?
They usually can, yeah, they usually can, unless they have other problems, right? But
Yeah.
if they're everything's gone fine, then yeah, they usually can. It's more of like weightlifting, right? It's
Okay.
more of being in a competitive sport
Yeah.
and being in a team.
Okay.
Yeah.
That is probably
Okay.
too much for
Yeah.
them to do. All right.
That's good.
It's not
to
that
know.
we don't
Okay.
want them to. In fact, we want them to be as fit as possible because that helps the heart.
Yeah.
Yeah. So the way without the heart pump, how blood reaches the lungs, so the blood in the head and neck will just by gravity go down, but the blood below is in fact when we breathe in, we suck up, so that blood will come up that way. But another important thing is something called the muscle pump. So our muscles in our legs are in fact very strong, and they, without us knowing, when we stand, they in fact contract and push the blood up. So the stronger you have, so that's why it's in fact good for them to
Walk
be
and be
active
active.
and walk and so on. Yeah.
Oh, that's
But
amazing.
yeah, but not. I mean, so if they can do competitive sport, that's great. But I wouldn't expect that from
Yeah.
them.
Okay. Thank you so much.
You're
I appreciate your
welcome. No, of
time.
course.
It's just normal if we're not athletes, right?
Yeah.
It's okay.
Yeah, exactly. How many of us are out there? I
Thank you,
totally
doctor. Appreciate it.
can. All right, thank you so
That
much.
was really good.
Yeah.
That was really good. Do you feel better about understanding that now?
Yeah. Yeah. This gives us so much more clarity. I mean,
So I didn't understand the part about AV canal.
yeah.
How that it's based on where the double outlet is.
Yes.
I didn't understand that. Okay.
So and I was envisioning. I was thinking, people are asking me, well, how can we pray for you? How can we pray for baby?
Oh, that's it.
And I said, pray that her AV canal closes. I'm not, and I'm hearing this band. I'm hearing there's a part of the baby that has to close after, and not knowing that's totally different from. But I'm so glad.